Hi, my name is Dr. Joel. I'm the founder of ATA Medical. I first started my medical journey in Singapore when I went through the very rigorous National University of Singapore, and this was about a decade ago. After I graduated, I first embarked on a journey to become a cardiac surgeon. I was very inspired when my dad went through an open heart surgery to remove a tumor at the back of his chest wall. This was done by a very skillful surgeon who greatly inspired me. So after medical studies, I embarked on this very rigorous training course with the National Heart Centre. Somewhere in the middle of my journey though, I saw a big need for Singapore's preventive medicine, and I recognized that the population benefits were so much greater and I could benefit a bigger group of patients by doing preventive medicine. And so this was the birth story of ATA and how we started this. The journey in medicine is never an easy one. I remember one of the toughest, the biggest or most tear-jerking moments I had since I was a doctor was when I was a very junior doctor, sometimes in my house officer to my early medical officer years. There was a patient who was recovering after surgery and she was well on her way to recovery to going back home, but she suffered a massive heart attack in the wards. I remember the emotions then. So many of us, the team of junior doctors, were trying our best to resuscitate her. We're doing CPRs, trying to set lines, trying to intubate her and send her to the ICU, but to no avail. She passed away very soon after. And I remember the moments and the difficulty when we had to break the news to her family who was expecting her home. These moments are what really triggers the passion and the emotions that I have towards being a doctor. And I feel that with all of these, it makes me a better doctor to want to do better for my patients. One of the biggest impact that health screening makes is in the area of prevention of cardiovascular diseases, namely heart attacks and strokes. Well, I think this is very important because it's very prevalent in our society, and MOH actually wages wars on things like diabetes and high blood pressure, which are coincidentally the risk factors for heart attacks and strokes. Diseases such as obesity, as well as chronic medical conditions such as the typical sangaos in Singapore, high blood pressure, cholesterol, as well as diabetes, are often poorly managed because of poor understanding of the disease from the patient's point of view. The other gratifying aspects I feel in my job is when patients come back to remark how they have improved in terms of how they feel, as well as how energetic they are in the daytime. Several aspects that I can often quote for are for patients whom I replaced the testosterone for, or even treated things like their weight, because in losing significant weight, one can actually sleep better, perform better, and sometimes, and most often than not, work better as well. These so-called lifestyle medicine aspects, while they may not harbor immediate life-threatening complications, often results in the patient living suboptimally with reduced energy, with fatigue, and with very low morals. It is in treatment of these areas that I find most gratifying because patients often see much improvement in their symptoms and their quality of life. Finally, I'm often asked about what guides my medical practice. I quote something that inspired me since my start of medical school, which is to cure sometimes, to relieve often, and to comfort always. Through my decade of medical practice, I've added another C to this, which is to care for my patients all the time. I hope to be a physician who can connect to my patients, to understand them through their times of weakness, and if possible, to journey with them out of their difficult times so that they can go on to live meaningful and fulfilling lives.